Hello everyone, my name is Elaine Price and I will be your clinical instructor for NU 102 Fundamentals of Nursing. Let me start by saying congratulations on your admission into nursing school. I am thrilled that we're going to be embarking on this journey together. I can still remember my very first clinical course. I was so nervous. So I want to help calm your nerves and assure you that everything we do is designed to support your learning, your growth, and your success. Today we'll discuss how you're going to be evaluated in the hospital. I know that clinicals can be a little intimidating, well maybe a lot intimidating, especially when it's your first experience taking care of real patients or practicing hands-on in the skill lab, sim lab. But again, all of this is designed to help you succeed. My goals for after you watch this video are for you to understand the purpose of evaluation in clinical practice, hospital, and simulation, be able to explain the hospital clinical evaluation process, and be able to explain the simulation evaluation process. So let's begin with the purpose of clinical evaluation in the hospital and in simulation. The goal of evaluation in clinical and simulation is not to catch you doing something wrong, but it is to measure your progress, support your learning, and ensure that you're developing the core nursing competencies needed to provide safe, ethical, and patient-centered care. In NU 102, you are going to be learning a lot of things, but some of these objectives are to learn to communicate therapeutically with patients and the healthcare team, be able to perform physical assessments and basic skills, apply critical thinking to plan and prioritize care, and demonstrate professionalism, safety, and ethical behavior. We evaluate you to ensure you are gaining these foundational skills to help you recognize your strengths and identify areas where you can improve. I want you to know that I will do my very best to be fair and objective. However, clinical evaluation can never be 100% objective. I'm continually working on my personal growth in identifying my own values, attitudes, beliefs, and biases that could influence the evaluation process. I will also make these things known to you so that you are not caught off guard. For example, I enjoy collaboration. Therefore, I really want you to ask questions and make suggestions. If you're a quiet student, this will be a time of stretching yourself. If you're a talkative student, you may need to allow time for others to collaborate. But I will make you aware of these values and attitudes as we go along. However, I want you to be assured that the same criteria will be used for every student. And please ask questions, or if you're unclear, or if you feel like something was unfair. I want this to be a supportive learning environment where mistakes are really part of the learning process. Now let's break it down into two areas, the hospital clinical and the simulation lab, because each has its own tools and expectations. In the hospital setting, we'll be using the Level 1 clinical evaluation tool. You received a copy of this in class, and it's also available online in Module 1 of this course. The checklist helps us keep track of how you're doing in areas like professional behavior. Are you punctual, respectful, dressed appropriately based on the guidelines that are provided, and following all the policies? How about communication? Can you give a clear report on your patient and use therapeutic communication with patients? Assessment. Can you collect subjective data through health histories and objective data through physical exams? How are you doing with critical thinking? Are you starting to recognize patient needs and beginning to plan care accordingly? And what about teamwork and safety? Are you asking for help when needed and following the safety protocols? In the hospital clinical setting, you'll be rated as satisfactory, needs improvement, or unsatisfactory. The goal is to receive a satisfactory rating in every category by the end of the semester. If you're not quite there at midterm, that's okay. We will work on it to help you improve. The evaluation checklist will always be located in your clinical journal. I'll use it to take notes about your performance after each clinical day, and you'll use that same journal to reflect experience, what went well, what challenged you, and what did you learn. Also, feedback will be completely ongoing. I'll talk with you one-on-one, offer verbal coaching during your clinical sessions, and provide written feedback in your journal. You are never alone in this process. My role is to support you in your learning. You are going to make mistakes. So therefore, stress is a normal part of this process. But I will help reduce it by clearly explaining expectations ahead of time, using consistent feedback, and encouraging you every step of the way. We want you to succeed. Now let's talk about the simulation lab. This is your chance to practice hands-on skills in a safe, controlled environment without the pressure of real patients, but yes, you will still be evaluated. For evaluation in the sim lab, we use the Crichton Competency Evaluation Instrument, or CCEI. Please refer to the copy that you received in class or to the one posted online in Module 1. The CCEI measures your ability to demonstrate nursing competencies in 4 main areas. Assessment. Are you collecting the correct data and following up on abnormal findings? Communication. Are you using SBAR, which we will go into detail in class and in clinicals? Are you speaking clearly with the team and patient and documenting accurately? Clinical judgment. Are you recognizing what's urgent? Are you learning to prioritize care and providing appropriate interventions? And then patient safety. Are you using hand hygiene, identifying the patients correctly? Are you administering medication safely? Everything that goes along with patient safety, obviously, is very, very important. So each item is going to be scored as either a 0, does not demonstrate competency, a 1, demonstrates competency, or NA, not applicable for this scenario. The CCEI checklist will also be available in your clinical journal, and I will make notes based on my observations during the simulation. I'll also provide a verbal debriefing right after your scenario so you understand what you did well and what you need to work on next time. There may be times that you have to repeat a simulation. For instance, if you perform everything correctly when inserting a Foley catheter but break sterile field and fail to correct yourself, even if you scored 100% on everything else, you'll have to repeat the skill. Remember, this is to help you and keep your future patients safe. Breaking sterile field happens. However, it is the nurse's responsibility to recognize they've broken sterile field and correct their mistake without proceeding further in the procedure. You'll also complete a self-reflection in your journal after each simulation. This is your space to think critically about your choices and build awareness of your own clinical reasoning. Remember, simulation is a safe place to make mistakes. What I care about is how you think, how you respond to feedback, and how you grow over the course of this semester. However, I do want to remind you that simulation should be treated with the same level of care as the hospital clinical setting. Make sure you follow the same dress code as clinical, including your scrubs and name tag. Make sure your hair and nails and jewelry all meet the specifications described to you in class. You will need to be prepared for the simulation lab the same way that you are prepared for clinical in a hospital. If you're not prepared, you may be asked to leave and make up the day later. Also, during simulation, you'll need to conduct yourself exactly as if you're in a real clinical setting. That includes showing respect to your peers, faculty, and yes, even the mannequin patients. After the simulation, everybody will help with cleanup and returning supplies to keep the lab organized and ready for the next group. As we close today, I just want to give you a few final thoughts. Most importantly, your success matters. This College of Nursing and faculty are for you. We genuinely want you to succeed. So whether you're in the hospital or in the sim lab, you're not expected to be perfect. You're expected to be prepared, safe, professional, teachable, and reflective on your practice. Evaluation is going to be an ongoing process. It is a conversation. You'll always know where you stand, and I'll be there to help you all along the way. Thank you for your time today. I'm truly looking forward to working with you and watching you grow into the amazing nurse that I know you can become.